Okay, so this is a tutorial on the left side of the heart. So it's following on from the tutorials I did on the right atrium and right ventricle. And there's a bit of overlap in terms of the structures in the left and right sides of the heart. So I'm not going to go over them in massive details again, so you can refer to those tutorials to clear things up a little bit more. So we'll start with the left atrium and then work into the left ventricle. So the left atrium, externally you can see this appendage here. So just like on the right side you've got this right atrial appendage or auricle, you've got the same on the left side. So you've got this left atrial appendage. And then if I rotate the model round posteriorly, you can see these 4 veins entering into the left atrium. And these are the pulmonary veins, and they carry oxygenated blood from the lungs back into the left side of the heart. So the function of the left side of the heart is to pump blood out to the rest of the body, oxygenated blood to the rest of the body. So I'll just rotate the model back round again and we'll talk about some of the internal features of the left atrium. So similar to the right atrium, the left atrium has 2 divisions. So it's a little bit smaller than the right atrium, but it's actually thicker. The walls are thicker. So the posterior division of the left atrium, just like the right atrium, has smooth walls, and this aspect of the right atrium, this posterior aspect, receives these 4 pulmonary veins. So the anterior half is continuous with this auricle, this left auricle here, and this half of the left atrium contains the rough ridges, so it's got the musculi pectinati. But unlike the right atrium, there's no crista terminalis. So you've got the smooth posterior surface of the left atrium and the rough, muscle-ridged anterior surface, or anterior half, which is continuous with the left auricle. But unlike the right atrium, where you have this smooth muscular ridge delineating the 2 halves, which is called the crista terminalis, you don't have this in the left atrium. So I've just sliced the heart in half, and we'll take a look at the wall of the atrium. So the wall dividing the right from the left atrium is known as the interatrial septum. And remember I showed you the oval depression in the right atrium. You've also got this oval depression on the left side, because remember it's a remnant of the foramen ovale, which is a hole in the interatrial septum which allows blood to flow from the right to the left side of the heart, bypassing the lungs, which are not functional at birth. So those are a few things to know about the left atrium.